Yes, you are.
Thank you. Welcome to the Neurosurgical Case Room. I'm sorry for missing yesterday's session. It was not planned on my behalf, but let's hope we can catch up tomorrow, inshallah ta'ala. So let's begin. I'm already giving a heads up. It is going to be a boring session relatively because basal ganglia are boring in comparison with insula and sylvian fissure and the temporal and the frontal lobe, etc. So I think it's always a good idea to give a heads up. Let's start. And we are going to cover a lot of imaging today so that once we come to the theory is simple. It's very minimal for as far as basal ganglia is concerned. If the pictorial representation has gotten good in your head, it would be a lot easier to imagine the structures. So since we are covering we have already covered the relevant structures, right? Can someone of you volunteer and tell me what is this? Which structure is this?
Insula.
Yes, insula, but what particular line is the line that I am marking here?
Circular surface.
That's right, this is circular sulcus. And what is this portion here? What is this here?
Sylvian.
That's right, this is sylvian fissure. And this is also part of sylvian cistern. I'll mark it with blue here. So this portion is the insular part of the sylvian cistern. This is the opercular part. And both of these make the opercular insular portion. We are clear about it, right? Of the sylvian fissure. Then we go deep layer by layer. We look at the insular cortex. We know that the insula has these long and short gyri, and there is a central sulcus which follows the orientation of the central sulcus of the lateral hemisphere. We all know this. Today we are going to take the insula away and look what is underneath the insula, which makes up the central core of the cerebrum. This entire thing is the central core, right? This blue thing here. Excuse the portion with the superior and inferior colliculi, but this portion here is the central core, which makes up the bulk here. And this is all gray matter, interspersed with white matter tracts in between, but most of it is gray matter. So let's start from the outside. When we look underneath the insula, what is this first structure that we see here?
Extreme capsule.
That's right. We see the extreme capsule, and it's not visible in this particular image, but the sequence goes like this from lateral to medial. This is extreme capsule. After extreme, we have the claustrum. The thing to remember here is extreme capsule is white matter. It is a white matter tract. Please keep yourself muted. There are a lot of people that are unmuted today. I have no idea why. Okay. So we have extreme capsule, which is a band of white matter. Then we have claustrum, which is a small portion of gray matter. Inside the claustrum, we are going lateral to medial or outside to inside. This is the direction that we are going in. Right now, we are somewhere here. Let me change the color, in fact, so that it's more visible. So at this point, we're here, the extreme capsule, then we have the claustrum, which is the gray matter. After claustrum, we have the external capsule, which is again white matter. What is inside the external capsule? What is the next structure inside the external? Can somebody volunteer?
Putamen, madam.
Putamen.
That's right. We have this grayish body here, which is putamen. And once we go slightly inside, we see the lentiform nucleus, globus pallidus. Let me write it here. This entire thing is the lentiform nucleus. This is putamen and the globus pallidus. So these are the gray matter bodies. These are nuclei, right? Basal ganglia. Then let me clear all of this. So this is from outside to inside. There is another sequence that you need to remember. I think you all would be familiar with this particular. Dr. Keep yourself. Let me draw it here. Please keep yourself muted, everyone. You all have been attending very regularly by this point. There is another sequence that you need to remember once you're looking at these structures. I'm going to draw these color-coded structures so that it's easier for you to relate. And you can imagine the same structure with very similar theme. Let me draw this first, and then we can discuss. So, you see these structures, there are multiple structures. They look like kidney beans, very colorful kidney beans, in fact. This green portion here, this is head of the caudate nucleus, right? Then the purple portion underneath, this is thalamus. The yellow and the orange portion, we all know the yellow portion is globus pallidus, and the orange portion is putamen. Let me color this all. And what is the structure that is separating them? This is internal capsule. I'm going to draw it thicker so that it's visible. The red structure is the internal capsule. Now, let's in fact draw another structure here. This outermost structure is insula. We know this. I have skipped all the external capsule, extreme capsule, and claustrum in between. Let's assume we have insula here, and afterwards we have this structure. Now you need to remember that once we talk about these structures, caudate is going to be medial to the internal capsule. This is caudate, and caudate is medial to internal capsule. Thalamus is also going to be medial. Medial and inferior, yes, but we are not talking about the superior and the inferior directions. What is going to be lateral? The putamen and the globus pallidus is going to be lateral to the internal capsule at most of the times, apart from very small portions where it merges with other structures. We are going to discuss it. So once we move forward, it's really, really important that you understand this illustration and keep that in mind. Are we all on the same page?
Yes, ma'am.
Okay, so there are certain other structures that you can see on this image here. You can see lateral ventricles here. Along with the lateral ventricles, there are structures which are visible. We have this septum pellucidum in the middle. Septum pellucidum makes the medial wall of this body of the lateral ventricle. This is septum pellucidum. And then we have the lateral wall. Let me draw here on this side. And you can see that there is a projection, a curvature, which is bumping into the lateral wall. It is making the lateral wall, but it is also creating this impression inside the wall. This structure is the head of the caudate. I'm going to color this so that it's easier for you to visualize. So this structure is caudate, which is bumping into the walls of the lateral ventricle. Then we have internal capsule, which is separating the putamen and the lentiform nucleus. But there's a small exception here. Very anteriorly, this is not the most anterior section. It's a coronal section, but it's not the most anterior one. If you take the most anterior section, you will see that this putamen here ends up merging with head of the caudate. This merger happens. And what is this merger called? There's a particular name for this merger. What is it called? Anyone? I wrote the name. That's okay. So this is corpus striatum. There are three structures and there are two combinations. It's easy to remember. There is no rocket science here. Caudate along with putamen makes up corpus striatum, right? Whereas putamen along with globus pallidus makes up lentiform nucleus. Why? Because it looks like a lens on all these cornal sections, axial sections, etc. So these are three structures that come in two different combinations. There is no rocket science going on here. Corpus striatum is important because that is where the putamen is not separated from the caudate by the anterior limb of the internal capsule. In these sections, you can see that there is a separation going on right here. If we go slightly anterior, I could not find really good images, unfortunately. All the images showed a very good demarcation. They did not show the merger, but I have a few illustrations. I'm going to show you them. They are where they are separate. They are individual structures. This portion here will be considered lentiform nucleus because you cannot see the merger of putamen and the caudate. If you go anteriorly, you are going to find that they are merged together. Head of the caudate is merged with the putamen. Hence, what will end up happening? It will be called corpus striatum. Clear all of this mess. Then we come slightly inferiorly because this is a coronal section. So we are going from superior to inferior direction. And you see the third ventricle in between. You see parts of it. They're surrounded by thalamus. We all know that thalamus makes the boundaries of third ventricle, the lateral walls of the third ventricle. Let's move to the next image. These are the axial sections. Part of them have been dissected, parts are not dissected. Let's start from the beginning here. You can see the lateral ventricle, right? And then you also see the impression that caudate nucleus makes into the lateral wall of this. Then we have the anterior limb of the internal capsule here. And you see this lentiform nucleus. Now this is called lentiform nucleus. Why? Because, am I audible?
Yes, you are.
Okay, my internet was giving me a warning. I have no idea why. Okay. Just give me a minute. So this portion is called lentiform nucleus because the putamen and the GPI, the globus pallidus, they are all together here. Then we also see the thalamus, the illustration that we were discussing previously. And in between the thalamus, when we go inferiorly, we are going to find the lateral ventricle. Here you can see that, the third ventricle. Here you can see that the lateral ventricle has been exposed in the axial section and choroid plexus is visible. Thalamostriate vein is also visible. On the other image, when you see part of it has been dissected, let's see, this portion has been dissected. This portion has been kept intact. And you can see how visibly the entire caudate here is creating this impression. This portion here, the lateral wall and the impression that is in its side, that is made by caudate nucleus. You can see the septum pellucidum in the middle. And once we go down, I am not sure if the tail is visible here. The tail of the caudate nucleus is not visible, but it travels down towards the temporal horn and goes in the roof of the temporal horn. Unfortunately, it's not visible here. So this thing, just imagine that it travels like this. The head is here. This is the body. Now we are going to see more images. This is the body. And then there's tail, which is negligible. It's not as visible. It goes down, merges with the temporal horn walls, and very anteriorly and inferiorly, we have amygdala here, just anterior to the temporal horn, and it will blend with the amygdala. Let me clear this and let's move to next images. It's a similar image with just a different section. You can see the thalamus here, which is very visible. It's not dissected here. You can also see the caudate nucleus impression and walls of the lateral ventricle. On this side, dissection has been done, so you can see the axial section. But there is nothing new in this image. This is us looking at the brain from anterior portion. You can see it's a beautiful image to look at the Sylvian fissure. I'm a part of me is sorry that I did not find this image while we were covering the Sylvian fissure. You can see how beautiful it is and how it starts right here and then it goes like this. On the other side, all the cortex and all the white matter has been taken away. So what you see is only the central core. And it's a lot easier to imagine the central core here. Now you see it in a different direction. You can see the corpus callosum here. Let's clear this. Underneath the corpus callosum, there's head of the caudate and internal capsule, which is visible here, just like a small impression. Then we have the putamen and the globus pallidus. We know that these are situated laterally towards the insula. Caudate is the most medial structure. We can see that. And unfortunately, it also does not show the tail of the caudate. Let's go find the tail. So, cortex has been completely taken away. All the frontal, the temporal, and the insular portion. You can still see certain impressions from the insular cortex here. This is extreme capsule. We are going to go layer by layer now. You need to imagine the layer that we minused here, that we subtracted here, that was insula. We took away the insular cortex completely. We stripped it off. Now we come to the extreme capsule. Let's go deeper. Once we take the extreme capsule, you can see that there is a small portion of this gray matter, which is claustrum here. And we have the external capsule. This thing here is the external capsule. They have dissected external capsule in this region. If you look very closely, and if you're looking at a bigger screen, if you look closely, there's this depression here. External capsule has been dissected from this portion. So putamen is visible. And we did discuss that underneath external capsule, we have putamen. So we are going from lateral to medial here, dissecting layer by layer. Also, I'm not sure if I have mentioned it before, corner radiata, when it comes downwards, it gets divided into these two capsules, the external capsule and the internal capsule. They are white matter tracts, and they are a continuation of the corner radiata. Let's move to the next image. Now we have taken away the external capsule, so you can see the putamen completely. And remember where the putamen was? I don't want you to lose the map. This was the map. So where was the putamen? The putamen was outside the internal capsule, lateral to the internal capsule. So you are looking at the corner radiata here. But if you take this putamen away, you will find the globus pallidus. And once you take that away as well, you are going to find the internal capsule. So we are still at the lateral surface. Am I making sense?
Yes.
Okay.
Yes, ma'am.
Let's move. Now you see that part of the putamen has also been dissected. Let me mark it more clearly so that it's visible. This is putamen here, which has been cut. This is the cut surface. So what you see now is it's called the lateral medullary lamina. And this separates the putamen from globus pallidus. This is again a white matter tract which separates the putamen from the globus pallidus. Let me clear so that you can see the image. Once we cut the putamen, we see this lamina, and underneath it, we are going to find the globus pallidus. Along with that, you can see parts of the internal capsule here because we have dissected portions of putamen. This portion here, you can see all these fibers. They are moving downwards. These are corner radiata, and this here is the internal capsule because we are going lateral to medial. So we are taking lateral structures one by one. We have taken away the putamen, and you can see the part of the internal capsule, and you can also see a portion of the retroventricular. The internal capsule has these other portions as well. There's a retroventricular portion and there's subventricular portion. Both of these contain optic radiations along with auditory radiations. Apart from this, internal capsule has three other parts: the anterior limb, the genu, the posterior limb. We are going to have a separate session on the fibers as well because they need a separate space of their own. But just this portion here that you see, the sublenticular optic radiation and the retrolenticular optic radiation, this is a part of internal capsule, and it is called retro and sub in relationship with this structure here, because deep to this we have globus pallidus, and this entire thing is lentiform nucleus, right? So anything behind the lentiform nucleus is going to be retrolenticular. This is the anterior orientation. This here is the posterior orientation. So posterior to the lentiform nucleus, we are going to have the retrolentiform portion, retrolenticular portion. Beneath the lentiform nucleus, we are going to have sublentiform portion. They have, in this image, they have only mentioned optic radiations, but the portions of internal capsule also include auditory radiations as well. We move to the next segment. So you can see internal capsule completely here. Along with the internal capsule, you can see the globus pallidus now, you can see the retrolenticular radiation, you can see the sublenticular radiation, etc. We also have anterior commissure going on here. Now look at this beautiful dissection. The caudate head has been retracted. This head was here, it was up, and it was making, if you look closely, this portion here is lateral ventricle, right? You can see the foramen of Monro here. So this was obviously the lateral wall, which has been dissected downwards so that you can look inside the lateral ventricle. This was up, but in this image, you can see this is the body of the caudate nucleus, and then this was the head, which has been retracted downwards. This portion is the body. It goes like this, curves around, and then it comes downwards like a tail. It's the tail of the caudate nucleus. And we have the amygdaloid nucleus here. Goes in. There is the, in fact, let me change the color. There is the temporal horn right here. It's not visible in this picture, but there is temporal horn right underneath it. So it becomes part of the roof of the temporal horn, goes anteriorly, merges with the, change the color, merges with the amygdaloid nucleus anteriorly. So this is an entire circuit. We have caudate, we have globus pallidus, we have putamen, we have thalamus, we have amygdala, and subthalamic nuclei, there's substantia nigra. These are all related, and they have a similar circuitry, but we are only focusing on these structures today. So I hope you will all remember that caudate is not just a small portion that we see on the axial sections in the CT brain. It goes and turns around completely. It curves around the thalamus, comes down, merges with the amygdala here. Let's clear all of this. So, a very small bit of theory. Caudate nucleus, it's an RC-shaped structure that wraps around the lateral part, and the body extends backwards from the head, separated from the thalamus. We have already done this. There was only a small portion that I did not mention. It is separated from thalamus by stria terminalis and thalamostriate vein. Head and body, they produce a prominence, and the tail merges with the amygdaloid nucleus. So we have done this already. Then this long tail arches downwards in the atrial wall and forms part of the lateral wall of the atrium. The tail reaches roof of the temporal horn, and it blends into junction between amygdala and lower part of the lentiform nucleus. So theory is a lot easier to cover once we have looked at all the diagrams. I have included this illustration because I could not find a good enough image with cadaveric dissection that will show how they are related. Because in the coronal sections, it looks as if putamen is completely separate from caudate, which is not the case. This portion here, the merger that you see happening, this is putamen, and this is caudate, and this portion here will be termed as corpus striatum. I'm only writing short forms now. Remember that we are looking at it from lateral aspect. So this is lateralmost structure. Whereas underneath, you can see the lighter part. I'll clear this so that you can see it. The lighter part, that is the globus pallidus, and then you see the thalamus there. And you also see this illustration of how the caudate curves along with the thalamus and ends into the amygdala. The structure shows, I think it does not show, but I'll tell it later on. There is another image. So you can see the caudate, and again, it follows right around here. So there are authors which say that the tail of the caudate nucleus ends at the amygdaloid nucleus. There are authors that say that it also gives fibers and blends in with the anterior perforated substance. So there is this difference between different anatomists. Then we have the thalamus and the stria terminalis. The stria terminalis separates tail of the caudate nucleus from the thalamus. Now, if you look at this beautiful, beautiful dissection, you'll see that it shows all the structures that we have discussed so far. Let me draw. So, you see the putamen, and the putamen has been cut to show the globus pallidus. So this portion here is the lentiform nucleus. Apart from the lentiform nucleus, we have this internal capsule, and you can see its orientation completely here. And once we go slightly above, superiorly, we see the caudate. This is the body, and it goes interiorly. We have the head here, and then we have the tail that goes down, and it comes down here, merges with the amygdala. Let's move to the last image. This shows a very interesting structure. The most anteromedial portion of corpus striatum. And corpus striatum was caudate plus putamen. There is a particular region here, which is marked, in fact. This is anterior plus medial. It is an anteromedial region, and it is named as nucleus accumbens. I'm not sure how many of you are familiar with it. So in some dissective images, it is visible. Sometimes it's not. In illustration was the best way I've found I could show you people. So what does this do? This is the reward-seeking center of the brain. All the reward-seeking behavior and the pain aversion behavior, it originates here. And it's in the basal forebrain. What it does is anything that needs motivation and action. So this is the center that changes motivation towards the action. So if you're motivated to study, but you're not actually studying, then there might be something wrong with your nucleus accumbens. Almost all addictive drugs, they stimulate this portion. And apart from this, it is also related with gambling associated behaviors and excessive dopamine seeking behaviors. It also plays a certain role for aversion or for negative stimuli. So that's it for today. We will continue this tomorrow because this was a really dry anatomy. I did not want you guys to be bored out of your minds. Please let me know if you have any questions or any feedback. I'm open to all of them. Do we have any questions? Okay, thank you so much, everyone. Thank you for attending. See you all tomorrow, inshallah, inshallah.